I'm Dr. Uma Dhanabalan, MD, MPH, FAAFP, MD standing for Medical Doctor, MPH for Masters in Public Health, FAAFP for Fellow of the American Academy of Family Physicians. Uplifting Health and Wellness is located in Natick, Massachusetts. We are a new center here. The practices that we will be offering for our patients is primary care, as well as a holistic and alternative medicine. We will be also able to do authorizations for medical cannabis. We are dedicated to providing the most upbeat care that is individualized for each patient. We are concentrated in also providing information for patients on preventative health, and also to offer a one-on-one consultation services for patients that are tired of being treated with the routine pharmaceutical and narcotic medications as well. Uplifting Health and Wellness also with cannabis medicine authorizations is providing care for patients that have undergone treatment with primary care and also been treated with different medications and are tired of taking these medications and have now heard about medical cannabis and are very curious as to if this is an option for them. So we see patients from ages 18 and above. We recommend that patients bring in their medical records. If they don't have medical records, we still are able to see these patients. The primary patients that we see have what we consider as chronic pain or intractable pain. Chronic pain is anything that they've had a condition that has lasted for more than 3 months, and they've also tried other treatments or have had failed treatments with other medications or different procedures, including surgeries and injections, and also that they don't want to try these medications. This is also an option for them to come and see us. Cannabis medicine is allowed to be given to patients here if they meet the criteria, and there's probably about 8 main criteria, but in Massachusetts it is also on the discretion of the medical provider, i.e. an MD or a DO. The patient will be given instructions as to why this might be an option for them and how medical cannabis has treated or has helped to heal patients with similar conditions as theirs. The main conditions that we see patients for are illnesses like glaucoma, Crohn's disease, COPD, asthma, seizures, migraines, muscle spasms. They could have had chronic pain from injuries, either work-related, non-work-related, or just wear and tear over time. Also patients that have had injuries where they have had multiple surgeries and they are, again, tired of taking the medications or are looking to be off those meds or to at least decrease in the amount of medications that they're on. The average patient that I see is usually on about 5 medications, the party pack of 5, as I say. They're on a blood pressure medicine, a medicine for diabetes, a medicine for cholesterol, a medicine for reflux, and also for some type of either anxiety or depression. And this is just to name 5 of the prescription items, never mind the medications that they're taking over the counter. Our patient experience will involve them coming in with a mass ID, i.e. their driver's license or mass identification, and the patient will be checked in. We will have them fill in an intake form, which will be information on who their primary care provider is, what their past medical history, any surgical history, any medications that they're on, if they've had any allergies, and then also what their symptoms are. What are their conditions and symptoms that they're coming in to get treatment for? We also then will get a detailed history as well on their family history, their social history. Are they working? What kind of work have they done in the past? Have they had different sports injuries? And again, what kind of procedures have they had? We then meet with them. I will see them or other healthcare providers The interaction will be either one-on-one, or sometimes they are accompanied with a family member or a friend or a caregiver. The patient then will have a detailed history and physical that is done, and then based on the information that's collected, we will then decide whether the patient should be offered a recommendation for cannabis. We then go over the benefits and the risks involved with that. We also go with as far as how cannabis can be consumed. Every patient has their own experience with how they have to consume it. So we educate them on the science behind how this product works and how this has been a product that's been around for thousands of years. And we know nobody has had a fatality from it. And as far as overdoses, the worst thing that most patients would experience is that they would sleep it off. It is not for everybody, but it could be for many people. And we need to see if it can help. So please talk to your doctors. If you're not able to talk to them, please contact us here at Uplifting Health and Wellness. And have a great day. Wishing you health and happiness.